Hello, welcome back to the Recovery Channel. Today I'd like to discuss the first month post-stroke. So typically the first month post-stroke, depending on the degree of stroke and the type of stroke, will be spent in intensive care or the stroke unit. They have a specific level in the hospital where neuro patients go, so you'll be sent there. I've been there several times, and I've found the stroke nurses so helpful. The stroke nurses are honestly salt of the earth. Their job is really heavy because nobody from a stroke can move. So they do a really good job of talking to me as a stroke patient, and also the family members. Stroke nurses are fantastic at hospital. I digress. Back to the first month post-stroke, it's kind of like a blur. You may have a catheter. I was nasogastric tube fed, and I had a catheter. I also had an adult nappy for the first probably, I'd say, 2 or 3 months post-stroke. Absolutely humiliating, but necessary. So the way I describe the first month post-stroke is like it's like the room's passing around you. Like if you've ever walked through a room, but you feel more like the room's passed around you. I don't know why you had a stroke. I don't know why I had one. Well, I know the cause, but I don't know why. Maybe somebody else is keeping score. Maybe somebody told a bell. Who knows why you had a stroke? The only choice you have is to get better. That's the only choice you have, is to do the best that you can. So I hope that helps you better understand the first hazy month post-stroke. You may not be able to communicate very well or at all. I could barely speak. I would write on a whiteboard with a texter with my one limb that I could use. Even then, my comprehension level was very low. I was writing basic words and not understanding. So that's the first month post-stroke. It's like the room passes around you. Thanks, guys.